A new study on COVID-19 says by March of this year, 3 out of 4 Canadians had detectable antibodies to fight the virus. Lauren Pelly is a CBC senior health and medical reporter. She explains how that study reached that conclusion.
So these researchers looked at multiple waves of the pandemic and studied hundreds of thousands of samples, trying to see how immunity built up over time. And to those of us who lived through the pandemic, the results weren't entirely surprising. That immunity began to build when people started getting vaccinated. And then there was that massive spike in infections from the Omicron variant. You remember that time where everyone seemed to know someone who was catching it. Well, after that point, that's when immunity from infection really started to go up. By mid-June last year, close to half of Canadians had antibodies from a prior infection. And by this March, that figure jumped to more than 75%. A lot of people also have what scientists call hybrid immunity. That's from exposures from both infection and vaccination. And as one of the study authors put it, this can really be a boost because it teaches you about more parts of the virus. Take a listen.
So that's where hybrid immunity becomes a helpful part. You not only now have antibodies that recognize the spike, but you have antibodies and ultimately T cells and other B cells, the cells that either fight viruses or make antibodies, that will recognize other components of the virus, creating a more robust way of fighting off the virus.
So he's speaking about the vaccine, which helps you understand the spike protein in the virus, and getting infected, which really teaches you about the entire virus. So it really thought to be a robust type of immunity, as he said.
So Lauren, what's the takeaway here? Are all of us better protected going forward?
So yes and no. At a population level, absolutely. This was a Canada-wide study, so overall Canadians are much better protected against this virus than they were before, especially because of that growing hybrid immunity we just heard about. But one key finding from the study was that this protection wasn't equal across age ranges. So younger Canadians were more likely to get that infection-based immunity. Seniors, though, a bit of a different story. By spring 2023, only around 60% of those aged 60 and up had that infection-based immunity that was found in these antibodies. Now, that's also an age group that's at a higher rate of serious illness. So for seniors who haven't got infected yet, that's a gamble that a lot of people are not going to want to take. And that's where booster shots come into this conversation. So this fall, we know that drug makers are updating the COVID vaccines to better match the currently circulating strains. And we're expecting that the provinces will be releasing those to the public in the weeks or months ahead. So if you are interested in getting a COVID shot, obviously that's something for everyone to consider. But particularly if you are someone who's high risk because of different health conditions, or if you're a senior, you're definitely going to want to consider getting a booster shot this fall. This is what we keep hearing time and time again from doctors.